Hello and good day, A.M.E. Zion Church. I am so blessed to be with you on this evening. My name, as you may know, is Mr. Darren Kent, affectionately known as DK, and I'm the Chief Communications Officer for the A.M.E. Zion Church. And I am so excited to come to you this evening and to bring you a special live program that is diving into one of our ministries in the A.M.E. Zion Church, and that ministry being the health ministry of the A.M.E. Zion Church. The health ministry is doing phenomenal things across our entire denomination. They are reaching out to those via live programming, utilizing our A.M.E. TV platforms, and then they have specific impact over our conferences. So when we come together at our annual conferences and at our connectional meetings, they are being intentional about reaching the people that are on site to make sure that their health is good while they're at conference. We all have experienced this now, right? We do understand that when we get on site, we need to make sure that we're healthy as well. We don't need to come to meetings when we're sick, right? We don't need to be on site knowing that we might have some health concerns and not have anybody know about it. So that's what this program that we put together is really going to dive into. We're going to explore health suites at our A.M.E. Zion denominational, national, and district level conferences. And we're going to learn about best practices on how these health suites are put together and how we address health emergencies that may arise in these different levels, whether they be district level or annual conferences. Now, we have special guests because, as you know, I'm not the expert when it comes to this. We have special guests that are joining us today that I'm going to ask a few questions to dive into this topic. And one of them being one of my favorite people in the world. Her name is Dr. Bai Solo. All right. If you see her name, please say it correctly. She's told me a couple of times that I might have said it wrong. It's Dr. Bai Solo. Okay. And she is the director of health ministry for the A.M.E. Zion Church. She is a pediatrician and public health consultant. She has worked in health ministries at the local church level for 20 years while at Shore Temple A.M.E. Zion Church, and now at the denominational level, leading the office of the health ministry of the A.M.E. Zion Church, under the leadership of Bishop George D. Crenshaw, who is the health committee chair of the Board of Bishops. Now, recently appointed as the director of Global Medical Missions Team, she's under the leadership of Dr. Dwight B. Cannon, who's the executive director of Global Missions of the A.M.E. Zion Church. So currently she lives with her husband and has her children in Maryland and attends Judah Temple under the leadership of Elder Scott C. Moore. So with that said, let's bring on Dr. Bai Solo. Dr. Bai Solo, join us. How you doing this evening?
Doing well. Thank you for such a warm welcome. Thank you, Brother Kent.
Oh, you're so welcome. I'm so happy to be here with you. We talk offline all the time, but this is one of the rare occasions when we're on together, and I'm just elated that you asked me to help bring these topics to light and let our denomination know exactly what we can do to be better during our connectional and district level meetings. Thanks. Now, I don't want to leave you alone up here because you have one of your staff members who's going to join us on this call as well. Her name is Reverend Andrea Jala, and her appointment or her position in the A.M.E. Zion Church is the South Atlantic Episcopal District Health Coordinator. She is a registered nurse by trade, and Reverend Jala has had many managerial and leadership roles in her nursing career, including serving as a director of a managed care organization in Georgia, and she currently serves as a clinical nursing instructor in Georgia in the Georgia healthcare system. She is a minister at Shore Temple A.M.E. Zion Church. I see that connection there. Shore Temple. Big up to Shore and Smyrna. Serving under Pastor Eldrin D. Morrison, where she has served in the health ministry over 20 years. My Lord. On the national level, she serves as the clinical coordinator for health suites and serves on the Global Missions medical team. Let's bring on Reverend Jala. How you doing?
Good. Hello. Thank you for having me. It's a joy to see all of you this evening.
Amen. Amen. Well, thank you both for being with us this evening. And again, for your visionary leadership, Dr. Biasolo, where you thought it'd be prudent of us at this time before we embark on the second half of our annual conference season to talk about these important topics regarding our health suite. So, with that said, I want to ask you just a set the stage question. So, when should you consider having a health suite, and why should we have a health suite?
Well, Brother Ken, first, thank you again to you and your team, to Sis Ayana, for giving us this opportunity and this platform to share with you. Always want to say thank you to the Board of Bishops for this opportunity, and to Dr. Crenshaw as the board chair for the Health Committee. When I was appointed as the Director of Health Ministry, I was asked to lead the Health Suite at the two connectional level conferences, the Board of Bishops every February, and then in July at the Connectional Council meeting, to have some oversight there for the Health Suite activities. And as such, our team of health directors across the Episcopal areas, we met together, and in conjunction with nurses, we developed policies and procedures. We revisited those policies and procedures to discuss what the health suite should look like, how it should run, and what were our guiding principles. So, to answer your question, when we talk about the guiding principles of the health suite, the purpose, we have our team there, as I mentioned, but the purpose is, trifold. One, we are there to provide emergency health services as needed, to recognize when there's an emergency, to respond to it. And that can mean if someone just has a cut on their finger, providing a band aid. But if it's something more serious that they require advanced care, arranging for transport to the nearest emergency room or urgent care center. And also, if capacity allows, we also provide screenings. So, for example, we may provide blood pressure screenings, check glucose levels, things of that nature. So, that in a nutshell is the purpose of the health suite.
Amen. Amen. Well, thank you for summarizing that. You want to add anything onto that, Reverend Jala?
Well, our health suite is composed of our team members who work diligently to make sure that members are safe during the conference time. And one of the things that we enforce during that time is confidentiality. So we make sure that persons who come into the suite to be treated are treated with confidence, with confidentiality, making sure all of the information are kept in a confined place where no one is reading any information on them. And we focus on that.
Yeah, that I never thought of that. I've always understood that a health suite needs to be easily accessible, and then you should have signage, right, so people know exactly where it is, and we need to know. But the confidentiality about who enters the health suite, what they're getting triaged for, is really important. I mean, even when you're in there, I would imagine that there are some provisions, like you might have like a curtain, right, in between, like partitions that separate the different areas. Am I going in that space? Is that correct, or?
You're correct. So even though we do not have curtains in there, but we have desks that are distanced from one another. So when person enters the health suite, speaking with the healthcare provider, no one is able to listen to what that provider is telling them, and any information that they are providing to us is kept in confidence. So we make it where no one is getting into anyone's information at that time. And then even when we start a treat where someone gets really sick, we have a particular area that we section off where that person is able to lay down and be treated unless they tell us that they would like certain persons to come in. We receive the permission, then we allow those persons to come in to see them while they're in there. So the doors are always kept closed.
Wow. Yeah, there's more to the planning process than we might think when we're coming and we're thinking from my media standpoint, and the ministers are thinking about putting, adding a health suite to, and the bishops are thinking about adding a health suite to the meeting. We're not thinking about any of that. Like we're trusting that you've gone through your due diligence, but it seems like you have to go through a full planning process way before an event happens, right? You need lead time when it comes to things of this nature. So with that said, and we'll get into the planning and procedures a little bit, but I want to ask this question. Who should staff the health suite? How do you recruit these people? How do you find these individuals in order for them to be added to the health suite? If you can enlighten us in that area, that's a question that I have myself.
Great question, and thank you for asking that. So persons who should staff the health suite should be certified. They should be licensed healthcare professionals. Persons who are currently, or even if they are retired from working in the health system. One of the things we look at is we want to make sure persons are licensed to practice, that they are practicing within their scope as they work in the health suite. Another thing we ask for persons to provide to us is the CPR card, which means if there's an emergency, you are licensed to perform compression. You are licensed to care for this person. And we work in our hierarchy where you have our physicians who are the ones that direct us. You have physician assistants, you have nurse practitioners, and then you have your registered nurses, and then you have your licensed practical nurses. You also want to include medical assistants because they do work in the health field as well. So even though they have certificate, but they are still licensed by the state to practice. We want to ensure that you are practicing within that state that we are assigned to at that particular time. So just making sure that you are licensed to perform whether it's checking your blood sugar, whether it's giving a medical advice, well, all of those are directed under the leadership of the doctors that are present in the health suite.
And you just brought up another thing that I never thought about, being licensed, not only in just being licensed period or whatever state, but the state that you're actually working in, right? I mean, if I could take the audience behind the curtain a little bit, like you're about to travel up north to be at a leadership training institute, right? And if you don't have coverage in that area, you could be out of you won't be able to perform what you would normally do down south in that area. Is that right? So how do you really need to work through those issues? Is there a traveling license like for the entire nation that you could get that can cover you?
So for the nurses, we have compact licenses that will allow us to practice in certain states. Now, one person in that suite must be licensed to work in there. So you might have physicians who are not licensed in that particular state, but you have nurses who, since the pandemic, have been given the opportunity and the privileges to have compact license, so you can work in those different areas. So I can work in New Jersey is different. I can work in Connecticut. I can work in Rhode Island. I fall under that compact guidelines to work in different states.
Wow. There it is. That's exactly what I was talking about. Anything you want to add to that, Dr. Bisolo?
No, I think Reverend Jala has covered that adequately, but the key is making sure that we look for local representation everywhere we go. So as we come in as the health suite on the national level, we always try to include nurses and other health suite team members who are from that area. That's their area. We want to make sure that we are inclusive, we're collaborative, but also to provide that local level. They have connections also with local state health departments, local clinics. So if someone gets sick, they can advise us and say, this is a better ER to send that person to. We just had that happen at the Connectional Council. We had a local nurse practitioner who was there who was able to say, this is where I would recommend you send this person to. So that's very helpful.
That's extremely helpful and saves you a lot of time and effort, right? They're in communication with the local health facilities. They've traveled the area. They know the hospitals, and they know what's the easiest way to get things done in that space. So I think I hear you saying that it's vitally important that you build your network, right? Your health ministry network, right? Across the entire nation and the globe, right? I mean, we're a global church. How does this look when you go across seas? See, I'm going off script here. This is not in my notes. I know that you're like, wait a minute, but how does this look when you go across seas? You know, Dr. Yabo, when you do missions trips, how important is it for you to tap into local health professionals when you actually land on the plane?
If I may.
Excellent question. Yes, excellent question. And we're preparing for our April 2026 medical mission trip to Liberia. First thing Reverend Jala and I did, make contact with local healthcare professionals. We are not the saviors coming from the US to treat anyone overseas. They have established health systems, established physicians and nurses. We're just there to work alongside them. So we led with meeting with them first, getting their buy-in, making sure that they will be on ground to see patients, to lead the team. We're just there as visitors. But we also have to get our temporary licenses for that country, for Liberia. So we're in the process of applying now for temporary licenses to practice in Liberia alongside the local staff.
If I may piggyback on that, Dr. Beislow.
Sure.
So Dr. Baxter spoke about us going to Liberia on our mission trip. So we were blessed this year in April. We made a trip to Liberia because we knew we have not traveled to Liberia since 2013, prior to the Ebola crisis. So we went out there just to make sure that we were connecting with people on the ground to see what were they doing, what are we bringing to them, and what can we receive from them in that stage. Because sometimes you think you're going to be a blessing. We are blessed when we enter that country. So we started making connections of persons that we knew on the ground. We're blessed to visit our community clinics. We were able to support those clinics while we were there visiting. Another thing we do when we at our conference level, trying to recruit, like Dr. Baxter said, we are recruiting members who are residing in those different states. We're reaching out to those presiding elders, and as we continue to recruit persons to serve on this team, because of course, one person cannot do this work. It is not it's teamwork, and it's just recruiting everyone. The city that we live in, the state that we live in now, healthcare is very, very essential to our race. So we are trying to promote that where we are educating everyone. So we reach out to those presiding elders where are the churches in your area that have health ministry. Who are those pastors that we can reach out to them? Even if the church is a small church, it doesn't matter, because some of those churches are close-knit, they're like maybe 2 or 3 miles from one another. We can all come together to create one health ministry in that area. So we're reaching out to presiding elders. Who are the medical professionals in your area that you can refer to us? Give us the information and let them know we will be calling them. And even if they want us to go down to their area, we will definitely take that time to go out there just to recruit, to make sure that everyone is healthy. We do not want to leave one person behind as we go journey on this new path that we are walking on.
Wow. Again, it seems like you have a underlying theme of this is not a takeover, right? This is an inclusive partnership, right? That we are trying to uphold across the board. Every time we get the opportunity to be able to bring a health suite or bring just information to another district or another connectional meeting, you want to tap into those people in that area, and you want to build your network based on those individuals that are health professionals that are already doing the good work in that area. You just want to join them, just want to meet them, and just want to collaborate with them, and then of course bless the people health-wise throughout our church. This is phenomenal. It's sort of like what I'm doing with the media ministry, just trying to tap into that area. So I empathize and I understand exactly what you're saying right now. So, all right, let's keep with it. Tell us, what are some of the steps when planning a health suite? So now we get into the practical, right? Like we gave it the vision, and now we're going into the exact how do we do this, and what are the steps to actually accomplish having a health suite when we're at our meetings?
So one of the first step, we have to establish policies and procedures as we prepare. We need to have a guideline, what all of us need to follow. We are not just going in there and performing things that's out of our scopes. So next thing is planning, like Dr. Beisler mentioned, looking in the areas, where's the closest emergency room, where's the closest pharmacy, and even for children and adults, because of course we know we have youth that will come to some of the conferences. We have persons bringing their little children. We want to make sure that we have adequate facilities for persons to go to. After we put that together, we come in where when we identify persons that will serve on the health suite, we want to start orientation, orienting them to the facility. Who do you call in case of an emergency? What are our steps, our process that we follow if we have an emergency? And how do we guide our records that we take during our service in the health suite? So we start that little orientation and getting to know one another, because we're now working as a team. We need to know one another. The next step, we look for coverage. The health suite is supposed to be set up 6 hours prior to the start of the conference. So we now have a schedule. We create a schedule. Who will be covering? We are covering from the time the conference starts to the end. We're even covering overnight, where if there's an emergency, they can reach us. So we have phone numbers. So we have persons on call. So even though we attend those conferences, most of us are not asleep at night. If there's an emergency, they'll reach out to us, and we tell them, do not hesitate to call us, because that's the reason why we left our jobs to come over there to make sure everyone is safe.
Right.
We'll look at the registration list. When persons are registering, we are asking for them to have a health buddy where if something goes wrong, who can be able to accompany you to the hospital, who can call your family members. And then we start stressing when you're coming, if you're sick, please, especially if you have a lot of respiratory issues, please stay at home. If it's anything that is contagious, just stay at home. And if you get sick while you're at the conference, then stay in your room and let us come to meet you at your door, because we know how to to caution ourselves before we enter your room. Now, if you have any issues that transpire while you're in the conference, they can still call us. So registration is, we ask that you bring all of your medicines that you take, bring enough to last you throughout the conference. Because of course, the doctor is in that state. By the time they write your prescription, we do not try to write prescriptions, because you should have your medicine and then contact your primary care doctor. It takes a lot of time. So bring your medicines with you, your asthma medicine, your pump, your whatever medicine that you take, please bring it with you as you come to the conference, making sure that you're okay. After that, we put that in our registration packet that everyone is aware of what's going on. And then we have to start the health suite with supplies. Supplies like Tylenol, Motrin, ice pack, pack for heat. We staff it with feminine products. We staff it with diapers. Anything that someone will need during that time. So we make sure that area is staffed with all of those supplies as we work during that. And then we start our process where we arrive on time and then set the stage to start working.
Whew. Wow. What an undertaking.
It is. And I'm sorry, I forgot to add that even though we are looking for healthcare professionals, any young adult who is interested in the healthcare profession, we are also recruiting for those to come, those who want to work in public health, because we cannot do this job alone. We have to train younger persons coming behind us. We are not going to stay in this area for a long time. Like you have your interns. We are happy and excited to bring in new and younger people to help us do this work. So the sooner we start, the better it is for all of us.
Oh, that's amazing.
Right. That's right, Reverend Jala. I mean, Brother Kent, like you said, it takes a lot of collaboration and a lot of planning. And it's also important if you are planning a health suite, and we recommend this for any conference where there's going to be more than 100 people. We recommend that you have a health suite because emergencies can arise. So plan for that. Work with your presiding elder, as Reverend Jala said, but also work with the planning team. So you should be in concert with the team that's booking the rooms for the hotel or for the conference center to make sure that you all are in alignment, that they understand what the medical emergency plan is, so that if there's an emergency, they contact you. And that has worked beautifully for the last 2 national conferences. They'll contact you, they will alert you, you all show up at the same time. If there's an incident, we provide incident reports to that planning team so that they are aware of what transpired, just to avoid any legalities. But that's all part of the planning, the policies and procedures that go into it. So we're here, Reverend Jala and I here. I know we've been saying a lot, But if you are trying to plan a health suite at your district or annual conference, we can help walk you through the procedures, enhance what you're already doing. But that's what we're here to do.
And I want to really put the number of months ahead of a conference out there in the atmosphere that you really need to execute everything that you just said, because that seems like a lot. I know you have some of the things that transfer from conference to conference, but as we articulated earlier, when you go to a different area, you've got to tap into that network and supply the needs of that specific area. So what would be a good buffer period that you need to speak to the planning team in order to provide proper services for a health suite before an actual conference begins?
I would say at least 3 to 6 months. And that will allow you to first get the permission of the presiding bishop, Episcopal leadership, the presiding elders, etc., and then the planning team, so that they know how much space you need for the health suite. So when they're going to make arrangements with the hotel or conference center to say, we need this much space for the conference, they're including the health suite in that, and all that entails.
And let's be real about it. Budget, right? You've
Yes.
got to think through that, right? We got to be able to get you there. We got to get your resources there, and all that you need. The space costs a little bit of money as well.
Right.
So you have to think through that, right? Am I right?
You are right, and the supplies, and the budget from your district, the Episcopal district, to provide those supplies. And a lot of times we think of it as, oh, there's a lot of money we're laying out, but that equipment can now stay with your district and move from conference to conference. It may not need to be replaced, about every 2 years, your blood pressure cuffs and so forth. Just the regular medicines, like Reverend Jala said, like the Tylenol, Motrin, you have to check the expiration date. All of that inventory has to be done each time, but yes.
And also, I don't think it does us any justice to invest in a health suite and then not promote the health suite on site, right? Like, to let people know that you're actually there. This is the area, and not a small sign. I'm talking about really pumping that out and getting the people knowing that are at the conference that this is available to them. I know you probably haven't even thought about this, and this is another off the cuff question that I'm throwing out there, but what are some ways that you plan on marketing the services when you're on site? Because you've had the planning meetings with the behind the scenes team that's working on the actual conference. You've spoken to the bishop, but then sometimes mix of a conference, it gets business. And when somebody's suffering in silence, they don't know where to go, right? Because the information hasn't been given to them. So have you thought through how you'll be market on site when things are happening?
Sure. One of the ways we've been lucky at the national level conferences that the planning team receives an announcement from us. So when they make their daily announcements, that's typically the first step. So we provide that to them, and we may have to remind a little bit, but that's typically the best route. So at the beginning of every day, when they make the general announcement saying where the bathrooms are or when lunch is, that's the time to advertise that there's a health suite in operation. Brother Kent helped us out during Connectional Council. He went up there on the stage and was like, hey, did you know there's a health suite? So those announcements from the general session helps. And it may not necessarily have been the planning team, but people who are running the conference, they need to know that we are there, or they need to know you're there if you're running a health suite. Share with them some information to share with the audience as well about the health suite's availability.
That's fantastic. I think it's really, that was an open-ended question for everybody listening. Okay, like when we go to these conferences, ask, where's the health suite? Find out if there is a health suite, and then encourage your leadership to have a health suite if they do not have one at this conference. Okay, they're here now, no problem. Get through it the best way we can, and we always do. But in the future, we need to be proactive in saying that this needs to be a mandatory thing at every single conference that we have in the upcoming future, and what we do. And I want to now lead into, we're about to wrap this up, but the services, right? that are offered with inside the health suite. I want to be clear to the folk as to what they actually can get at a health suite. I think some people might think, oh, this is only if I'm about to die, like if I'm having a heart attack or something like that. When really it's not that. I think you're going to enlighten people of all that you offer proactively, right? And then obviously if something does actually occur. So take us into that world of all the levels of care that you offer.
So, and that's a very good question because persons do not know what we do in the health suite. So take, for example, when you came into conference and you have not eaten and you start to feel lightheaded and dizzy. The health suite is there for you to come in, and then you tell us your health history. So we'll now ask you, have you eaten? Did you eat today? No. Are you diabetic? First thing. Yes. Are you diabetic? And then you'll hear a person say, yes, I am. I haven't eaten yet. So we go ahead, triage that person. When they get in, we check in the vital signs, the blood pressure, the heart rate, the respiration, and then we check the blood sugar. Sometimes we find persons whose blood sugar are below 100 or below 70. Now, it's our role to make sure that person gets something to eat. So we will now find, we carry in the health suite, we carry peanut butter crackers. We might have some fruit, banana, and then we have orange juice. We have a little diet soda, just something to spike up the blood sugar. Mm-hmm. That person was sitting there, would check the sugar, give them something to eat, and they will remain with us 30 minutes to an hour because we want to recheck the blood sugar, make sure that blood sugar is stable, and then now reach out to the kitchen staff. Can you get them something to eat, especially something high in protein so that it can be okay? And then we'll do another sugar check before we'll let you go. Mm-hmm. If you fall in the hallway and they call us, we have to go in there, secure the area, make sure everything is safe, and after we do our assessment, bring you back in there. If you have a head injury where you hit your head, that is a major concern for us. Right. So now we have to see, did you hit your head? Did you bleed? And then we start calling, okay, who is your health buddy that is with you? Right. Do we need to call EMS? Mm-hmm. And so that's where you have the practitioners, the nurses are there doing the assessment, but the doctors, physicians, nurse practitioners are also there with you, assessing that person to make sure they are stable and okay before we call EMS. And sometimes we might call EMS before that time. So we've had multiple incidents that we did have to call EMS, even though persons were refusing to go. But it is our responsibility, the same care that we give when we work out in our different areas of work. Those are the same excellent care we want to bring to our conference and to our when we are there. Another thing that we do at the Health Suite is we partner with different organizations. So whether we're having a health fair, persons come in and host a health fair for us, that's another way of exposing what we do at the Health Suite.
Wow. Yeah. And I have experienced this firsthand myself with people that I'm close to. Will not reveal names at all, but and then myself, I've come in, I checked y'all out, seen what y'all had going on, and it's been just a welcoming environment, right? That eases your level of anxiety while you're on site, because sometimes you feel when you go to these conferences like you don't have anybody that you can tell these things might be going on. It could be something new that arose right before you came to conference that you just need to monitor, that you need to have another set of eyes on. And I believe that's what the health suites are there for, that you have extra people that can look out for you, that are even you told us one thing, we see you across the room, we have that in mind, and we know that we can assist the best way we can if we see something going out of what's ordinarily happening with you. So I love this. I'm so glad we had this live program. If you have questions, if you heard this information, all right, and you have questions that came up as a result of everything that you've heard today, or if you have a meeting that is about to come up, and you want to get in contact with Dr. Basolo or Reverend Jala about, how you begin to prepare even more than what you just heard right now, and you want to build a network in the area, you want to connect, and you want to make sure that not only that when you gather, you're just talking about health, but you actually are providing health services on site. I need both of these beautiful individuals to give us the way to contact them in order to get connected in this health ministry area for health suites and health ministry related matters, period. Programming and information and drives that need to happen, blood drives, on and on and on. There's so many things regarding our people health wise that we need to be concerned with. So Dr. Biasolo, Reverend Jala, give us your final thoughts about what we spoke on today, and then if you could leave them some information in order for them to contact you.
Sure. We'll do that. And again, thank you for this opportunity. I'm just going to share ways that you can contact us. There's forms there because we want you to connect with us. We want to connect with you. We'll place this in the chat, is a Google form that will collect a little bit of information from you, and we'll reach back out to you. That's also a way for us to send you our newsletters that come out quarterly. And then we also have a new Facebook page. So you can follow us on the A.M.E. Zion Church Health Ministry Facebook page. We're posting valuable information. We just posted information on how to get prepared for respiratory season, what vaccines you should get, who's your reliable source for vaccine information, things of that nature. So you can reach us through that channel. But again, like you said, we are family. And I just wanted to share with you pictures of some of our health suite staff from around the nation. You see some of them here at General Conference and the more recent Connectional Lay Conference. And we're just blessed to be surrounded by a team of just wonderful healthcare professionals who are committed, who are passionate. Many of them, a lot of times, what I love about this, a lot of times, especially when we have staff from the local area, people will come into the health suite and they feel more comfortable because they see Sister Floyd. They know Nurse Joyce Floyd. They're happy. They see Brother D. They may see Sister Pfeiffer, and they're just happy to see someone there. And so we just want to say again, this is family. We need your support. And there's a role for everyone. So for example, if you are not a healthcare provider, but you just like to help at the administrative desk, help us with the forms when someone first comes in to register, we welcome your presence as well. We just have you as part of the orientation, making sure, like Reverend Jala said, we maintain confidentiality. We want to make sure that everything we see or hear in the health suite stays there. It does not go out. We don't want to deter anyone from coming into the health suite because they feel their information may be leaked out. We sign an oath as medical care providers that information does not leave that room or that space. So I'll stop there and see if Reverend Jala also has some parting words for you.
So thank you, Dr. Beisel, and thank you, Mr. Ken. I encourage everyone to try to establish a health ministry in their church. When we host these local conferences, we were blessed last year at Shaw Temple. We hosted a flu vaccine clinic, immunization clinic, where persons were able to receive COVID vaccines, flu vaccines. This year, South Atlantic is going to Augusta. We also have a flu clinic. Walgreens is coming out to provide vaccines for persons who would be interested. So we're pushing vaccines because we know in order for us to live healthy here in the United States and treat people, we must be immunized. There's no exception for that. And the only way you cannot be immunized if you refuse to take it. And then when you get sick, it is worse. The symptoms are worse. So please let us make an effort to be immunized during this time of the flu vaccine. Thank you, Brother Kent.
Amen. Well, listen, I am, again, so blessed to have had the opportunity to be able to host this event on this evening. I got excited in the middle of it because I was like, there's so much information we need to know, and to pack it into an hour is just really unfair because I know that there are many people that are listening to this right now that need more. They're interested. They just have questions. And, we're not jamming this down anybody's throat, right? We're not making them do it. We're offering this service to people, right? And, you might have heard budget and planning and things like that. They will work with you. It can be tailor-made for what you can do at your level, right? Every conference is different. Budgets are different. Priorities are different. But please don't let that dismay you from contacting them in order to get the information, at least, so that you can begin to prepare to have health suites and health information at your conferences. If nothing less, just information on a table to get them, to get people in the right mindset of how to take care of themselves proactively before something goes wrong is where we want to strive to be. I think we do a lot of reactive care, but we need to start getting ahead of the game. And I know we have the people at the helm to do so. So thank you so much. I'm clapping it up for y'all. I want everybody to give a clapping hand emoji in the chat right now. If you were blessed by everything you heard on this evening, I want you to take time right now to hit the share button and share this with somebody else. Copy the link, send it to somebody, and let them know that, hey, this is something that we need to do at our conferences moving forward. Send this to your bishops. They've heard it already. They know the information, but it doesn't hurt to reiterate it, because as you know, the more people that speak about the need for this and then it rises up to the top, then obviously they've got to supply the demand. Okay. So God bless everybody on this evening. Again, my name is Mr. Darren Kent. I am the Chief Communications Officer of the A.M.E. Zion Church, and I'm here once again. I have just had the opportunity to be in here with Dr. Bisolo and Reverend Jala, and we were talking about health suites just now. So take this information, get it to the people, and be able to bless those moving forward in the world of health inside our denomination. God bless you, everybody. Y'all have a great night. Great night, everybody. We love you.
Thank you.
Thank you, Brother Kent.
Thank you, Brother Kent.
You're welcome. God bless. God bless, everybody. Take care.
God bless.